Cyber attacks are costly, but some industries took a harder hit than others. The healthcare sector alone suffers the most, costing $10.93 million on average. That's almost double that of the financial sector. To talk about this, we have Sonji Lee from Frost Sullivan. So, Sonji, what makes healthcare a target for cyber attacks?
So healthcare remains as one of the most attractive targets for cybercriminals due to the enormous amount of data that it manages and its reliance on uninterrupted access to the digital infrastructure. They are leveraging on a digital ecosystem and also managing on the networks of electronic health records, connected medical devices, and the financial system. The acceleration of digital transformation, aging population, and the rising demand for the healthcare services have made the industry an irresistible target. Telehealth platforms, remote patient monitoring, and AI-powered diagnostics have reshaped the healthcare industry, but also opened the new vulnerabilities, allowing attackers to disrupt operations or shut down and even put their lives in danger. Many healthcare institutes often run on an outdated IT infrastructure and legacy system as they are already strained by the rising costs and the staffing shortages, which makes them often find themselves unprepared in cybersecurity, particularly for the sophisticated threats and fall into the digital shadows.
So, with that, what cybersecurity strategies are most effective for high risk sectors like healthcare?
So, to address and combat against these rising threats, healthcare organizations must adopt a defense in-depth cybersecurity approach tailored to their unique needs. A radical shift in the healthcare cybersecurity is crucial, and the attacks are relentless and the defense is equally dynamic. First, gain a sense of where the organization stands. Regular risk assessments can help to spot vulnerabilities before being exploited. Data breaches has been one of the most common type of attacks in healthcare, and AI-powered detection tools can also help to cut the breach response time, identify anomalies faster. And secondly, institution programs provide a continuous employee training to mitigate the human error. The people in the healthcare organizations are the most important assets, but they may also have been one of the big factors of the risk if they are not cyber trained. And the government and regulatory bodies also play a role. While the regulations exist, they remain fragmented and creating the loopholes. A standardized approach to healthcare cybersecurity would be a step towards resilience.
Just for better understanding on this, Sonji, how do cyber attack costs differ across various industries?
Cyber attack impose financial burdens across all industries, although the healthcare consistently experience the highest breach costs. The average cost of data breach in healthcare exceeds $10 million, largely because of the immediate and potential life-threatening consequence of the disrupted medical services. Other industries, like finance and energy, have invested aggressively in cybersecurity to detect and contain threats faster. They still and also face the substantial cyber attack costs, but their risk profiles are different. Banking and financial services typically allocates 15 to 20% of the IT budget to cybersecurity, compared to healthcare estimated at around 10%. The chronic underinvestment leaves the industry vulnerable to the asymmetrical threats. But the true cost of cybersecurity isn't just financial. Healthcare organizations also need to consider the non-financial impact of the attacks. A breach in healthcare includes operation disruption, injuries, and the loss of life.
Thank you so much for your time today, Sonji.
Thank you. Thank you for having me.
Once again, that was Sonji Lee, Consulting Associate at Frost & Sullivan. For more news, visit healthcareasiamagazine.com.